Well, I'm excited today to have one of the top acupuncturists in San Francisco with me today, Rebecca Fettig. And she shares a similar philosophy in that I know she believes in compassionate care and also integrating care of all types, which is very important, and I think probably the future of medicine. So I'm happy to have Rebecca here today. And I thought I'd start off with just a simple question like, how did you end up becoming an acupuncturist?
Sure, Barry. I think it's becoming anything, it's a lifelong journey. And I think the key part to it for me was just really being intrigued by the human body my entire life. In younger years, I was a dancer and trained professionally in ballet and modern. And I think the next steps after that was probably in teenage years, really wanting to understand how to be a better dancer. It got me interested in anatomy and physiology, how the muscles move, how the bones move. And as I went deeper and deeper, you tend to go smaller and smaller. And so eventually in college, I got a degree at the University of Wisconsin in medical microbiology and immunology. And the pulse of this was really my interest in, why it is we're able to be these strong human beings and not be riddled with disease or, what's actually going to make us live longer and better lives. And it was really kind of unique in that the last quarter of the 20th century, we had the development of the science, immunology. And I was wondering what to do with this, really. And I knew I wanted to help people, and I knew I wanted to be some kind of doctor. And I think there's sprinklings of things, like learning about Chinese medicine in history classes, for one, really kind of cued me into what the philosophy of Chinese medicine is all about. I was also part of the pharmaceutical industry for quite some time as a pharmacy technician. My father was a pharmacist, which is really kind of what intrigued me in that arena. And so I got to see medicine from that retail pharmacy lens of how big pharma operates. And something didn't really sit well with me as I was there helping people get their prescriptions and sometimes seeing people on 20 meds, one person.
Yeah, it's unbelievable sometimes.
At a very young age, I was seeing, wow, we're a really over-medicated society. And I kind of knew that there needed to be another way. There had to be some other options out there. And really, I think the key turning point was in Madison, Wisconsin. I worked at an alternative pharmacy co-op.
Really?
And this was a really interesting place where you had Western pharmaceuticals that were being dispensed at the counter, and then at that same counter, you went around the corner and there were Western herbs and homeopathic remedies we made there on site. And you had these really invested pharmacists, say someone would come in and pick up their statin medication, and we would, you had a pharmacist there saying, well, hey, there's this information on CoQ10. You might want to actually take a look at this, and you can talk to someone over here. And there was really this integrative model that was happening there. And I knew that the place was really quite unique. And I became more interested in looking at some of those alternative methods and listening to people's stories who came in. We were this really trusted resource for the community and trying to educate them on what else is out there. And I thought, wow, what if we could do this on a practitioner and a doctor level? If people could actually receive care like this.
Right.
And
an integrative approach early on.
Yeah, and that place was really that stepping stone to wanting that for the rest of society. And it just so happened that there was that intrigue in Chinese medicine, and listening to people's stories who came in, and acupuncture really helped them out, and I received it, and I was really intrigued by the philosophy. This is really, what's influenced in their culture, and all of China's Taoism was there a long time ago, that philosophy of the Tao, this ineffable force that exists on the planet that's you can't name, see, touch, taste, hear, but it exists and connects us all. I thought that was kind of a really unique concept, and the yin yang theory and the elements, and really it offered this holistic approach, which I think was, to me, it seemed like that was what was lacking in our Western society.
And of course, it had been going on for hundreds of years.
Yeah, there's truth there, right? And, you know, it seems like what we have here and the development of the AMA, and it all stems down from exactly our outlook on how we see things. And mechanistic philosophy was rampant in Europe in the 1700s, and this is when sciences developed. This is when we got the microscope and chemistry and physics and germ theories, and we ended up dividing things into smaller and smaller parts, looking for answers to cure people. And that was really you know, influential thing that we did, because we developed all these life-saving tactics and antibiotics, and that's great, but there's restriction there. And when you try to apply it to a human and the care that they need, right? Yeah,
you're treating symptoms instead of treating the whole person, unfortunately, which can happen with that kind of focus.
Yeah, exactly. And I went into that too. I went into microbiology, and in just life circumstance, I kept feeling that there is another way to work with people. And so, yeah, I started studying Chinese medicine, because it really does offer that concept of that we are this web, and you can't just treat and compartmentalize one system of the body and think you're not going to affect the other parts of the person. So, yeah.
Great, that's a great story. Great, you know, a journey to finding your niche.
Yeah.
So let me ask you something else. How do you use your skill in Chinese medicine to help people?
I think when people come into the clinic, they're looking to solve some kind of really persistent health issue they haven't been able to find a solution for in normal conventional means, and they come through my door and we sit down and we figure it out together. And I think a colleague of mine once kind of summed it up really well, in that he thinks, oh, you're a healthcare detective. And I kind of like that. That's what I'm doing, is I'm investigating. I'm going deeper with the person to really understand where have their limitations been, where have their weaknesses been. And, you know, people come in to get out of pain. I think that's kind of the primary thing, is there's some pain in their body, and I work a lot with chronic pain. So anything from like tendonitis injury that's been going on for months to a more chronic condition like an autoimmune disease of rheumatoid arthritis. That's become one of my specialties, is working in the autoimmune realm. And I think that what Chinese medicine offers is, you know, that idea of we can actually find the root of why the person is dealing with what they're dealing with. And, you know, a lot of times that root is not exactly some kind of genetic predisposition or some injury or something wrong. There's other things going on for them. And, you know, people come in, they realize they need relief from the toxic overload that's hitting them from society. And in more ways than one, right? It can be jobs, relationships,
stress,
food,
emotional, environmental, lots of things nowadays.
Yeah, and whether the people realize that or not, that's also what we're trying to heal too. And I think that Chinese medicine allows that capability of being able to figure out what that is that's preventing them from healing. What is that consistent stressor? Not let's just get rid of the pain and get rid of the symptom, but let's go deeper. And
yeah, because it'll come right back if they get back in the same setting without making some changes.
Yeah, and that's what I tell people too, is that you could get all the acupuncture in the world, but if you don't do these lifestyle changes, you're not going to ultimately get better. And so I think that they come in and want a little bit of empowerment about their health, because sometimes people, they're at a loss of how to fix something and it hurts them, and they want relief. but they also need to figure out how to keep going. And the treatments help, the repetitive treatments help, giving that physiological on button, like shake them up, like, all right, your body, stop doing this, we're going to move in this direction. And you need some of those repetitive signals. This is why acupuncture, I think of it as like a physiotherapy, and it's possible to change habits. I think, hopefully we have all experienced that at some point in our life.
Yeah, especially if they've experienced some of the benefits and then they want to stay there.
Yeah. And then the other key part to patient care too is with Chinese medicine is it's not just acupuncture, it's herbal therapies and trying to create a custom formula for someone to really be able to heal on a day-to-day basis, change their food habits, change their lifestyle habits. I'll do Qigong, a movement meditation practice with some people if it resonates with them. And I think that, people are, it's hard to prioritize health. When we all lead busy lives, right? This is, and, to have that reminder on a daily basis, I think is good training to put health first, as your wealth is in your health.
Yeah, absolutely.
Yeah.
Yeah, and happiness and everything else.
Yeah, and they want to reconnect, right? I think we all really want to reconnect with ourselves physically, mentally, emotionally. And Chinese medicine offers that idea of, hey, you may have this shoulder pain, but actually the reason it's not healing is that, you have this inflammatory issue of your heart. Let's treat that. And they may not have realized that. And then all of a sudden everything kind of falls into place. They're sleeping better, the pain's gone, you don't have anxiety, there's a lot of layers there. It's really nice.
Yeah. So there's it's kind of like some of the stuff Louise Hay talks about with this symptom is usually related to something else, and how you link them and work on that is really important.
Exactly, yeah. Chinese medicine has that kind of scope of being able to really ascertain, like, is this emotional issue that we're dealing with, or is it strictly physical? And guess what? Actually, it's never that clear cut. There's always layers to it. So I find it really fascinating. And there's ways to really delve into what this is. I use a palpation-based acupuncture that was from my teachers, Kiiko Matsumoto and David Euler. It's now termed the Kiiko method, where you're actually there with the patient and hands are on the body, and you figure out how someone is going to change in the treatment process then and there on the table. And so patients get that feedback. The treatments are working most often. We can be able, I think there's this word gets thrown around my clinic nearly every week. Now I see multiple times a week people say, oh, that's magic. And I smile because it's magic, but it's rooted in science. It's evidence-based medicine. It's come to be that over time. And it's kind of neat when a majority of the people that I see that come through my door were able to show that to them in the clinic.
Do you feel like the hands-on connection in the exam helps connect you more and improve trust? And
of course, that's something too that I think today, doctors aren't putting their hands on patients. And
I agree.
They're looking at, it's amazing that we have the technology of all the images and scanning and test results, but, there's something unlike anything else when the patient understands, oh, I have a pain here, and then we do something and it's gone, it changes. That's healing in itself, and to know that someone's actually caring for you enough to show you that, it's good stuff.
I totally agree. That's definitely one of my philosophies. So tell me how you got all this great training, or where you went and what you did and how you came to get your expertise.
So yes, I flew out from Madison, Wisconsin to San Francisco the moment that I decided that I wanted to train in Chinese medicine. and studied here for 4 years and did an externship in Hangzhou, China, at their medical university there. And then what a lot of people don't know, for a profession like this, or actually any board licensed profession, is the education doesn't stop once you finish your degree and you get your license. You have continuing education that you need to take part of for the rest of your life, or as long as you want to keep your licensure. So I think really right after my training in the academic setting is when I started to come across the Kiiko method. So I began right away learning that and implementing that in the clinic. And I keep learning that through my own clinical experiences and then also my teacher's clinical experiences too. And there's lots of other things that I've done over the years too. I think that kind of, I can see it as really training, you know, a lot of more investigative work in nutrition, a lot of training in Qigong to be able to understand meridian systems better. And I would say meditation for sure. That's about doing that about a dozen years, going on silent retreats. And I think that that's really changed me as a person, and I hope that that's changed me as a practitioner. And
absolutely. Well, I love to hear stories about how you took a patient and you did something and they improved significantly. I don't know if you've got one, but
I have plenty of them.
You probably have a lot of stories, but I think I love to hear them. And so you have one in particular you might want to tell us about, how somebody came to see you and what happened in the process. Of course, no names.
No, of course. And maybe I'll share one that has that kind of layering effect, which is kind of fun. Great. A little bit more than something maybe more muscular, which I think sometimes it's pretty simple to treat, but some of these more persistent health issues are actually really what I think Chinese medicine serves us very well. There's this one patient, she had this ongoing stomach pain. That was her main complaint, as well as anxiety. And she had been having stomach pains pretty much on a daily basis, or, you know, every few days for quite some time in varying degrees. Probably over 10 years she's been battling issues of her stomach, and she would go into doctors and do colonoscopy imaging work, and physically there's nothing wrong with her, and she's kind of at a loss. They label IBS, irritable bowel syndrome, as her condition, and saying you should take some over-the-counter medications to help you deal with some of these things. And nothing was really working for her. And so she comes in to see me, and so we sit down, and I don't just look at the pain. I look, okay, tell me about yourself. Let's go into it. And I find out some other key things. She had hip pain, for one, that was different than the stomach pain. No, never made connection to prior. There was actually in her childhood, there was some physical and verbal abuse that she had dealt with. And I think that trauma also was contributing to her state of being. She actually had to go on disability leave because of the pains and the anxiety that were part of her life. And so she comes in, and we decide, okay, we're going to give you a treatment plan. You're going to come in every week for acupuncture for a couple months, and we're going to put you on some herbs and nutrition. And why don't we run these food allergy testings, because someone never thought to do that for her before. And well, we find out eventually through the course of treatments, we find out, well, there was actually no food allergies present, or food sensitivities present. And I think it was really not until we discovered a lot of this trauma that she had affected her nervous system and affected her enteric nervous system.
Right.
So I decided to put things aside and treat this trauma and work on the nervous system itself. And within a treatment or two, her stomach pains were really becoming milder and milder. And she was one of these people who came in because she was very anxious. She's scared of the needles. right?
Really?
It's daunting for a lot of
something new.
people. And I could sense every treatment she come in, she would ease up a little bit more and more once she started to realize that it doesn't hurt. It's actually a very relaxing experience. And towards the end of our care, I could see her actually relax and sometimes maybe even end up in that state of sleep, which a lot of people do.
Yeah.
So it was really neat to see how her anxiety transformed over time. And stomach pains went away. She wasn't dealing with all the digestive upset. And I think the key thing of it too is like seeing everything that the patient needs to heal. And I always ask, like, what do you love to do to take care of yourself? Like, and she's like, oh, I love to dance and I love to run, but she had this hip pain that was preventing her from doing it. And so I thought, okay, well, actually, we need to take care of your hip pain. If you want to actually feel better, you need to actually engage in some of those things that you love, like running and dance, in order to heal too. So I kind of like that we delve into it just to be able to see the person off to become a little stronger, and she could go back to work and she could dance and run again and all those things she wanted to accomplish.
So you got to treat the whole person to get everything in the right relationship. And, that's great. Mm-hmm. Yeah, I totally agree that that's the way we need to approach it in the future for the total being, total person for their total care, whatever illness or problem they have. Do you have? I know you told me that one of the areas that you like to treat or that you have treated is chronic pain. Are there any other areas of expertise that you really enjoy and you really that you feel like you've got mastery in treating different symptoms, some other disease processes?
Yeah, I think I alluded to earlier is the autoimmune realm.
That's a tough one too.
It's tough on many levels. I think the area that stands out the most is I haven't met an arthritic autoimmune condition, and we haven't been able to either go into remission or at least heal from the pain for an extended period of time.
That's a big statement. So that is actually exciting to hear, that it has that much power to really turn some of that around, because that's a tough one.
Yeah, exactly.
And people get treated with really heavy-duty medicines that sometimes cause other problems in addition.
That's what I'm most excited about seeing. And hyperthyroid has been one of my specialties too. I've been seeing, like, when people with hyperthyroid cases come in, a lot of people are told that they have to kind of damage the thyroid and take medication for the rest of their life, and to see that a patient gets really excited when that doesn't have to happen. I like seeing that too.
Is there any one value or any one thing that you would say overpowers how you take care of people? Anything in your value system that? Okay.
Yeah. Actually, there's something my father told me a long time ago that always stuck with me, and he said that people don't listen to each other enough in this world. And something about that that really kind of went into my core when he said it, because I was listening, for one, and I made it a point to listen to people, and I think that what I do nowadays is I'm a professional listener, in more ways than one, right? I think, when you're a good doctor or practitioner, half of it is, of course, your training and your skill set and some experience, but half of it is actually being able to listen and observe your patient and what they really need and be perceptive to what they really need. And I think Chinese medicine, there's training in that. There's training in looking at every person as unique. The shape and size of your face says something about your makeup and who you are. The tone in your voice does as well. Certain shades of skin, all of these things that you can just sense by the person's demeanor too. You sense what the patient might actually really need. Is someone that's a type of person, behaviorally speaking, that does well with having things under control? Are they going to be able to excel if they have some kind of stricter protocol to follow? Or is this person stifled by control and it needs to be a little loose, and I need to let them figure out what the right thing is and not me have them tell it? There's a little psychology work to it.
Well, yeah, that's you recognizing their personality type, which I think is important for you to really connect and for them to follow anything you might suggest.
Yeah. And I think that, when you're a good doctor, that's what you do, is you observe, and you observe like nothing else. And and you do it right from a place of love. And, that there's that recognition too, when you're taking in that whole person, is you also, you recognize that there is no distinction from yourself and the other. You try to drop that veil and realize, just like you want to be in good health, everyone else wants to be in good health. Everyone else wants to excel and be a good person, be a healthy person. And that's, I feel like, all the healing in the world that we need, and I try to impart with patients. I think it's really important. Well,
all I can say is just hearing you talk about this just resonates with me to the core. And I think we're blessed to have people like you out there taking care of people in need. Mm-hmm. I know I want to thank you personally, because I went to you actually as a patient for some help with an issue, and you've helped me tremendously already. But I know you help probably hundreds of people a year or more. And this is what I think the future of care is going to be all about. And I'm just happy that you were here and could share your philosophy with us today.
Thank you for having me. Yeah.
You bet.